Usmle CK Step 2 wants you to know that patients with myasthenia gravis can present with myasthenia crisis. So, a patient with myasthenia gravis could uh, get into the acute state called myasthenic crisis. The myasthenic crisis is characterized by weakness in the respiratory muscles of the patient. Could be a moment that the patient cannot breathe anymore and have to be intubated. So let's see. Myasthenic crisis is precipitating factors are infection on surgery, pregnancy or childbirth, uh, tapering of immunosuppressive drugs, medication, for example, aminoglucosidos and beta blockers. Specifically, aminoglucosidos can give you a myasthenic crisis. Sign or symptoms is generalized or weakness of respiratory insufficiency and dyspnea, respiratory weakness, respiratory insufficiency, and dyspnea. The patient cannot cough, cannot manage the secretion, and they can draw a lot of secretion from the throat, and they probably gonna need to be intubated. So generalized and oropharyngeal weakness, respiratory insufficiency, and dyspnea. The treatment is intubation for deteriorating respiratory status to manage the airways and plasmapheresis as well as glucocorticoids. So first you have to do intubation for prevent like a bronchoaspiration or pneumonia or a more further complication. And then the second option is intravenous immunoglobulin or plasmapheresis or intravenous immunoglobulin. So Usmle CK wants you to know that. Usmle wants you to know the management of salicylate toxicity. So salicylate is some kind of medications that you can get when you have like a some kind of medicine that is used for topic pain, like a rheumatic arthritis. So elderly people, they usually get like some creams on the knee pain, elbows pain. So they can be chronically get intoxication with this kind of medication. So management of salicylate toxicity. So activated charcoal is one of the options. Intravenous sodium bicarbonate is another option. And specifically this question was asking about the third option, that is hemodialysis. So activation charcoal is it's pain to salicylate in the gastrointestinal tract and decrease systemic absorption. But if the patient is already in consciousness, you cannot give it that. So give it between 2 hours of acute ingestion. It will likely help if it is a chronic ingestion. Avoid in confusion or know the patient, so that the patient is not awake if not able to swallow. Another option is intravenous sodium bicarbonate. So intravenous sodium bicarbonate alkalinizes the urine and sodium, it changing the salicylate excretion. But this require a large amount of volume of fluid to be administered. If in this case, this question, the patient is old, he won't be able to manage that large amount of fluids. Most in the case of these patients that have like a swelling on the legs. So the third option would be the right one in indications for hemodialysis. Inability to tolerate large volumes of sodium and bicarbonate, pulmonary edema, acute or chronic renal failure, persistent acidosis or worsening clinical conditions despite sodium bicarbonate therapy, or severe ingestion of shock, seizures, CNS dysfunction, or cerebral edema. So this last option is the more recommended for all patients with edema on the legs, that they cannot tolerate a large amount of fluids, patients that are like in chronic intoxication. So the more likely treatment would be indication for hemodialysis.